Welcome to today's deep dive.
Yeah.
You probably already know about baldness, right? But this study in the Journal of Cosmetic Dermatology really dives into the challenges that practitioners are facing when they're treating AGA.
Yeah, and it's interesting because it's not about the science of hair loss exactly, but it's more about the information landscape surrounding it.
Yeah, so like how do practitioners kind of navigate this world that's flooded with marketing and conflicting research and all the societal pressures too?
Yeah,
It's really fascinating.
definitely.
One of the things that I thought was really interesting was this point about AGA often being missing from medical school curriculums.
Yeah.
I was like, wait a minute. So how are practitioners supposed to stay up to date on best practices? It's not even part of their core training.
That's a really good point, and it is a valid concern. Medical knowledge is always evolving, and so, unfortunately, sometimes these specialized areas like AGA can lag behind in the formal education.
Right.
So it means that a lot of the learning is happening kind of on the fly,
On the fly, yeah.
which can leave practitioners vulnerable to some of the biases that we see in commercially funded research.
Yeah, and speaking of commercially funded research, I thought this was a really clever example that they use in this study.
Mm-hmm.
It's the Alfonso study from 2005,
Oh, yeah.
which looked at the psychosocial impact of AGA.
Right.
And it's cited all the time.
Yeah.
But here's the thing. It was funded by Merck,
Uh-huh.
the company that makes finasteride.
Right.
So the study authors were kind of curious, did that funding influence how practitioners are interpreting the findings?
Yeah.
So they created these trick questions
Oh, wow.
based on the abstract of the Alfonso study.
Okay.
So they were really testing whether practitioners could identify these potentially biased conclusions based on the way the information was presented.
That's fascinating.
And the results are kind of eye-opening.
Yeah, what did they find?
On average, 42% of practitioners were misled by the trick questions.
What?
It makes you think, if seasoned professionals can be swayed by, just some clever wording or framing,
Mm-hmm.
how much more vulnerable is the average person to, all the marketing spin out there?
Absolutely. That's a really good point. And I think it just highlights the importance of critical thinking, right?
Yeah.
We can't just take information at face value, especially when it comes to something like hair loss treatments that's so commercially driven.
Right.
It seems like the study authors were really concerned about that, like the potential for practitioners to unknowingly pass these biases on to their patients.
Yeah, for sure. And then the study kind of goes into the ethical dilemmas that practitioners are facing.
Uh-huh.
And it seems like they're constantly walking this tightrope between evidence-based care and patient expectations.
Exactly. Because you have to think about it. Patients are coming in with, maybe anxieties about their hair loss and hopes that are often shaped by advertising, by
Right.
societal pressures. They might be looking for a quick fix or a miracle cure, and the practitioner has to balance those expectations with the reality of what treatments can actually achieve.
Yeah. And they quote one practitioner in the study who said, "It's difficult to know when to treat or not without being able to confirm the outcome."
Mm-hmm.
So it seems like there's this real struggle to stay true to the evidence, but also manage, the hopes of patients that might be desperate for a solution.
Yeah. And it's not just pressure from the patient, right?
Oh.
The study also talks about the role of societal norms
Yeah,
and how they influence how we think about baldness in general.
absolutely. And
It's like there's this underlying message that baldness is something that needs to be fixed.
a flaw to be corrected.
Yeah, like it's a problem.
Right. And so that puts practitioners in this really difficult position,
Mm-hmm.
right?
Mm.
Because they're trying to provide this evidence-based care,
Yeah.
but they're also dealing with patients who might be coming in with anxieties and expectations that are completely shaped by these societal pressures.
Yeah, it's this complex interplay of factors.
Yeah, absolutely.
Yeah.
And it's interesting how they bring up the Norwood-Hamilton scale in the study. So it's it's this tool for classifying male pattern baldness,
Right, right.
but it has its limitations.
Uh-huh.
And I was surprised to learn that 71% of the practitioners that they surveyed were still using it,
Wow.
even though the study authors pointed out that there are recommendations to use alternative diagnostic tools
Yeah.
that might be more accurate. So it's like,
It seems like a contradiction.
yeah,
You have these practitioners who are clearly very aware of the nuances of AGA and the need to stay current on research,
right.
but they're still using a tool that may not be the best reflection of all those nuances.
Yeah, it makes you wonder if there's this kind of disconnect between the ideal
Mm-hmm.
and the reality of clinical practice.
Yeah, I think that's a good point. I think that disconnect is something the study is really trying to get at.
Right.
And it's not about, pointing fingers or saying that practitioners are doing things wrong,
Right.
but just acknowledging the pressures and the complexities that they're facing.
Right. In this field that's, constantly evolving and, influenced by so many different factors.
And one of those factors being the societal pressure that we were talking about earlier.
Great.
The study found that things like advertising media portrayals, even just like casual comments that people make, can actually contribute to a lot of unrealistic expectations and distress among people that are experiencing hair loss.
Right.
It's like there's this underlying message that baldness is something that needs to be fixed.
Right.
Like it's a flaw that needs to be corrected.
Right. And so that puts practitioners in a tough spot.
Yeah.
Because they're trying to provide evidence-based care.
Yeah.
But then they have patients coming in with all of these anxieties and expectations that are shaped by those pressures.
Absolutely. And that's where I think the study's emphasis on informed consent is so important.
Yeah.
It's not just about, explaining the treatment options,
Right.
but it's about having those really open and honest conversations about what the benefits are,
Yeah.
what the limitations are, and like really trying to manage expectations in a realistic way.
And I think that's where those findings about the trick questions become so relevant.
Right. Because if practitioners themselves
Yeah.
can be swayed by just like these subtle biases in the way that information is presented, how do they make sure that they're presenting information to their patients in a way that's really objective?
Right. How do you help patients separate the facts from the hype?
It's a huge challenge.
Yeah, for sure. And the study found that 96% of practitioners believe that men need to fully grasp the approach to treatment
Oh, wow.
before moving forward.
That's a really high percentage.
So it really highlights how important clear communication is,
Yeah,
and that shared decision-making is so important in this field.
absolutely. It's about empowering patients to make choices that are aligned with their own values and goals.
Right.
Not choices that are driven by pressure or these like unrealistic expectations that they might have.
And it's about recognizing that there's no one-size-fits-all solution.
Exactly. What works for one person might not work for another. And some people might even choose to embrace their hair loss rather than pursuing treatment.
Right. And I think that's such an important point that the study brings up. It's like, it's pushing us to think beyond just this narrow focus on fixing baldness and to really consider this broader context of individual experiences and choices.
It's about acknowledging the diversity of perspectives, right? And recognizing that baldness doesn't have to be a negative thing.
Yeah, for sure. And it's worth noting that the study itself acknowledges that there are some limitations.
Oh, yeah. Like what?
For example, the sample size was relatively small,
Okay.
and most of the practitioners they surveyed were in the UK.
Right. So the findings might not be generalizable.
Exactly, to other contexts.
Yeah, that's true. It'd be interesting to see similar research done in different countries,
Yeah,
different cultural settings, to see how those factors might influence things.
totally. And I also noticed that the study didn't specifically focus on the experiences of women with AGA, which I imagine can be quite different from men's experiences.
Yeah, definitely in terms of societal pressures and treatment options.
Yeah, it's just a reminder that there's always more to explore,
Always.
more nuances to uncover.
Yeah, this study's like a valuable snapshot
Yeah,
of the challenges that practitioners are facing, but it's really just the tip of the iceberg.
I feel like we keep coming back to this idea of context. It's not just about understanding the science of hair loss.
Right.
You have to think about the societal pressures, the marketing messages, all the ethical dilemmas, all these things that are shaping the experience of AGA.
For both patients and practitioners.
Exactly.
Yeah.
And it's not just about AGA, is it?
Right. It kind of makes you think about how we navigate information in general,
Right.
especially in any field where there's a strong commercial incentive to, push certain treatments.
Yeah, absolutely.
Inclusion.
It's like when I think back to that Alfonso study example,
Yeah.
those trick questions, it really makes you wonder how much of the information that we consume
Right.
about anything really is kind of subtly influenced by, who's funding the research or who's profiting from it.
That's a really good point. It really highlights the importance of being critical consumers of information.
Yeah.
Like, we can't just passively absorb everything we read or hear.
Right.
We need to be asking those questions like, who funded this? What are their motivations?
Right.
Are there any potential biases? Like, really looking at how those findings are presented.
I think this deep dive has made me a lot more aware of those biases,
Yeah.
not just in the context of hair loss treatments, but in general.
Right, and that's such a valuable takeaway, I think.
Yeah.
Developing those critical thinking skills that you can
Okay.
apply to any area of your life.
So as we're wrapping up our deep dive into this study,
Hmm.
I'm curious, what are you going to investigate further?
Oh, that's a good question.
What questions has this raised for you?
For me, I think it's made me think more about the sources of information that I rely on
Yeah.
when I make decisions, whether it's about my health or finances or really anything.
Mm.
Am I just kind of taking those sources at face value, or am I really digging deeper?
Right.
Am I looking for biases? Am I thinking about alternative perspectives?
Yeah. It's a lot to think about, but I think ultimately this deep dive has been about empowering ourselves
Yeah.
as consumers of information.
Yeah.
You know, it's about taking control of our own understanding and not letting ourselves be swayed by marketing or unexamined assumptions.
Right. Knowledge is power, but only if we use it wisely.
Well said. So thanks for joining us on this deep dive. We'll be back soon with another exploration of some fascinating research. Until then, stay curious.